Good afternoon. Today I'm going to talk to you about the management of care when dealing with patients, but basically what NCLEX is going to look for as far as management of care and what kind of questions are going to be on the NCLEX exam. And the first thing to know about management of care is that it's the way that nurses provide care at the bedside, but also how we delegate to other people, how we coordinate care with other healthcare providers. And so NCLEX wants to know that as a nurse, you are able to communicate with other providers and that you are still able to keep the patient as your focus. According to the NCLEX questions, 20% of the questions on NCLEX are going to be related to management of care. And there's lots of topics, as I just mentioned, things like advanced directives. Do you understand about advanced directives and the legality of them, and who has the final say-so? Patient advocacy. We always say as nurses that we are advocates for our patient, but when it comes to ethical issues or even advanced directive issues, are you an advocate and do you understand what that means? Case management. As nurses, we coordinate care for patients, whether they're going to a nursing home or home, scheduling PT, blood draws, maybe for Coumadin levels. And so again, does the nurse understand that and understand what their role is? Patients' rights are a huge aspect of nursing care, and making sure that we understand what each patient's right is and how do we go about taking care of our patients. Again, I talked about collaboration with other team members and communication, confidentiality, consultation, delegation, prioritization, which is a big aspect of NCLEX, but it's also a big aspect of nursing care in general, because you've got to be able to prioritize care not only at the beginning of your shift, but hour by hour, sometimes minute by minute, to be able to prioritize who needs your care. And are you able to understand prioritization? Are you someone who can use your critical thinking and your clinical judgment and be able to change your priority of care depending on what's going on with all your patients? Things like delegation. Can you delegate some of the aspects of your care? And do you understand as a nurse what your scope of practice is? Do you understand what other people's scope of practice is so that you can delegate to them? Informed consent sometimes can be kind of a tricky situation as well. And so as a nurse, who can give consent and what does informed consent mean? Legal rights kind of goes along with patient rights, but quality improvement. As nurses, we are called to always give quality improvement, whether it's our standards of care, whether it's care maps, whether it's just making sure that we use evidence-based practice. So all of those things are covered under the management of care. So one of the first things is advanced directives. We talk about that a lot. We ask our patients, do you have advanced directives? But what does that mean? And what is your role as a nurse? If a patient says, no, I don't have advanced directives, what are you legally liable to do? Things like Patient Self-Determination Act, and that the patient has a right to decide what measures they want taken, what measures that they don't. Being able to talk with families about informed consent and about advanced directives and power of attorneys and those kind of things. And does the nurse understand those things? Advocacy, again, treatment options. It's very easy as a nurse to kind of go along with what the doctor says, but are you informed enough, and are you always looking at making sure that your patient has all the information so that they can make the decisions that they need to make? Side effects, when you're giving medications, do you understand what side effects are? Do you understand how to watch for them yourself, but also to teach your patient on what they need to watch for? Case management. Again, evidence-based practice, discharge information. We know from research that discharge instructions or lack of is a big reason for medical malpractice suits, because patients say when they get home they haven't been adequately taught about what to do. And so nurses have kind of a lapse there. People are really wanting to get out the door, but as nurses, what are we required to make sure that our patient knows for follow-up besides just giving them a piece of paper? So there's going to be questions about that on NCLEX as well. Do you understand what your role is? And teaching. As an RN, you're required to do discharge teaching, and you're required to make sure that your patient understands what the teaching is, and to make sure that they have follow-up instructions. Again, it's not good enough anymore to just hand them a piece of paper. And that goes along with patient rights. They have the right to know what you're discharging with. They have a right to know about their medications. They have a right to know what happens if they refuse. So you want to make sure that you're really going over those kind of things, because sometimes as nursing students, you know, we're really focused on what meds and what treatments, but there's all the outside responsibilities for an RN that you need to make sure that you know. And another big one is collaboration with the healthcare team. Not just with physicians, but with physical therapy, occupational therapy, surgery, anybody that has anything to do with that patient. We've got to be able to communicate. And a lot of times we're gatekeepers. A lot of times we know where the patient's going and what's going on with the patient, where other people on the team might only know their aspect, but the nurse is kind of the one that's coordinating everything. And so if you can't communicate that, if you don't understand your role in that, then things get lost and patients can be harmed. So again, it's making sure that you understand what your role is. Again, conflict resolution goes along with that. We've all heard stories about, you know, physicians that lose their temper or whatever. But again, we as nurses need to understand what our role is. We need to understand that our patient is our top priority. And we need to be able to speak up. And when there's conflict, we need to be able to be educated. We need to understand what our role is. We need to go to our resources. But then we ultimately need to be an advocate for our patient. And that all goes along with collaboration with healthcare members. Again, and so how do you handle conflict? That's where a lot of your psych nursing comes into, is being able to speak to people appropriately with therapeutic communication, not only your patients, but with other people on your healthcare team. And then HIPAA. You've got to understand HIPAA. You've got to know what is covered under HIPAA and what you're allowed and not allowed to do. So you want to make sure that you review that. SBAR kind of goes with collaboration. You've got to know how to give report. And SBAR is your best tool, but you've got to be able to understand that as a nursing student. And NCLEX is going to ask you questions in relevance to that to make sure that you understand what SBAR is about and how to give report and how to get report. Because again, communication is a big problem as far as medical malpractice. Things don't get passed on, or somebody thinks they told you something. And so being able to communicate is a big part of competent nursing care and a big part of management of care, but just keeping our patients safe. Informed consent is another topic underneath that. You know, you got your regular 20-year-old that comes in, informed consent's easy. But what happens when it's a 2-year-old and mom and dad are divorced? You know, how do you get informed consent? And so being able to understand what your resources are, being able to understand what the laws are, and knowing who has the right to give consent and when is consent needed. Consent for a procedure, consent for surgery is different than just consent for treatment. And what happens if the person comes in and it's emergency? You need to make sure that you understand because that keeps our patients safe, but it also protects their rights as well. So you want to make sure that you know about informed consent. And then again, scope of practice. I can't emphasize enough that you need to understand the scope of practice for the registered nurse, but you also need to understand scope of practice for other people in your healthcare. So when you're delegating, we have nurse practice acts. Every state has a nurse practice act. And so understanding what is it that an RN is allowed to do and when is it that an RN is overstepping their boundaries. Understanding what negligence is and malpractice is, and obviously trying to avoid that, but understanding when that takes place. If you have a patient that you need to restrain, making sure that you're not having assault and battery, but understanding when it's medically okay to do those things and when it borders on negligence or malpractice. And then what are your rights as a nurse? We have rights just the same as the patients do. So understanding what your rights are, nobody expects you to have them all memorized. But again, you got to know where to go get that information and who your resources are. And then how do you report if something is happening? Say you come across a fellow nurse who you think is impaired. What is your chain of command and what are you obligated to do? Moving on, supervision and delegation. Supervision and delegation, unfortunately, hasn't been one of the nurse's strong points. It's always been easier to do it yourself than to delegate. The problem is one person just can't do everything. And so we need to understand how to supervise and how to delegate unlicensed personnel. So again, that takes some practice. It takes some good clinical judgment to decide what you can delegate and what you cannot. It would be easy if there was just this clear list of you can and you can't, but everything is based a lot on patient condition. A patient that's chronic might be able to be delegated over a patient that's acute when it's the same thing. Maybe it's taking blood pressure. On an acute patient, you wouldn't want an unlicensed person to take their blood pressure if they're in a critical situation. Where a chronic patient, it may be all right. So again, understanding what the rules of delegation are and being able to follow through with those, and a lot of that is supervision. You can't just say, I need that blood pressure, but you need appropriate supervision of that person, and you need to understand what that person can and cannot do, and you need to be able to give parameters on what you wanted reported back to you, because ultimately it's the RN that is responsible for that patient. But again, we can't do everything ourselves. We need the help of other people. So again, understanding what delegation is and what can and can't be delegated. And one of the things to remember are the 5 rights of delegation. Just like the 6 rights of medication administration, delegation has 5 rights. You need to make sure it's the right task. Again, blood pressures aren't blood pressures for everybody. It needs to be the right task. The right circumstance. Maybe this morning, the blood pressure on the patient was stable. It was okay to delegate the blood pressure. But by afternoon, that patient started having chest pain. Then it would not be a good circumstance. So again, understanding that things change. The right person. Maybe I have a new nursing assistant who's never done it before, never taken a blood pressure, and I'm not quite sure how well her skills are. That might not be the person that I want to send in doing a lot of my blood pressures until I am assured that they know what they're doing. The right direction and the right communication, again, it's up to the RN to be able to communicate to that healthcare provider exactly what they want done and what the expectations are. And not just assuming that because they work at your place that they know what needs to be done. And then again, the right supervision. Excuse me. That means that person needs to know when to come to me, what I expect, and I need to follow up. So again, the 5 rights of delegation. If you can remember those things, it will help in the long run. And so that was just a skim of the management part of NCLEX review. There's lots more to go over, but again, hit those NCLEX review books and start looking at those kind of untechnical things that nurses are responsible to do. And we'll see you again tomorrow. Bye.